Welcome, everyone. Thank you so much for joining us today on our webinar, Chronic Inflammation, Disease, Pain, and More. It's going to be presented today by Dr. Paul Urkel, naturopathic doctor. My name is Dr. Navneet Nipper. I'm a medical advisor with AOR, and I'm going to be the host and moderator for today's presentation. Before we get to it, let's get through a few housekeeping items. If you would like to ask a question, please do so throughout the presentation by typing into the question box on the right-hand side of your screen. And question answers will be at the end, so fear not if it doesn't get answered right away, we will get to it. Please note the presentation is being recorded for future distribution. The content of the webinar has not been evaluated by Health Canada or the FDA. It's very much meant to be educational in nature and should not be taken as medical advice. We always suggest you consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease, and the opinions of myself and Dr. Urkel are of our own and may not reflect those of Advanced Orthomolecular Research, Inc. So, now that that's out of the way, we can meet our presenter today. Dr. Paul Urkel has time and time again demonstrated excellence in this field. He's a board-certified naturopathic doctor practicing in Toronto, Ontario. And Dr. Urkel is uniquely positioned to speak to this because he has a clinical focus on neurological health, chronic pain, lucky for us, brain injuries, and he has even developed the Concussion Fix, which is an online course. He's heavily involved in teaching and education within our community and our profession, and is frequently writing, lecturing, both to healthcare practitioners as well as the public. He is the medical director for Advanced Orthomolecular Research, and his chief mandate has really been about sharing the science so we can formulate really effective natural health products. All that being said, without further ado, I turn it over to Dr. Urkel.
Thank you so much, Dr. Nibber. That's a great intro. And this is a topic, as you mentioned, that is right up my alley. And I had a lot of fun putting this one together. So I'm actually really excited to share it with everybody. And as always, please, just a reminder, put in your questions in the question box. We will be answering them at the end. We have a lot of content to get through, so it's pretty ambitious. So I'm going to be pretty focused with our time. And my goal today is to give you what you need to know, kind of my clinical pearls, if you will, for chronic pain. This is a behemoth topic. So inflammation, chronic pain is applicable to anything from, joint pain to headaches to menstrual pain and everything in between. So we're going to break it down into bite-sized pieces, and this is how I'm going to kind of walk us through this. So we are going to talk about some of the root causes of pain and inflammation. We're going to talk about the three main types of chronic pain. Then we're going to look at some nutrients that are foundational to reduce inflammation and specific pain conditions. And you're going to learn a little bit more about what I do with my practice as we go through just a little bit of an intro, because I think that the integrated model, which you'll see here, and I'll come back to this slide in a couple slides, is really the best way to address chronic pain. Okay, so as I mentioned, lots of different types of pain. A lot of people think of pain typically as, joint pain or the typical after an accident, but pain is the #1 reason people will go to their family doctor. It is a massive, massive problem for our healthcare system. And, one of the big reasons it's such a burden for our healthcare system is because it is not something that really is well managed, and it is a big drain on the financial ability of a healthcare system. And chronic pain usually is, just by the way, even in the word, by definition, chronic. So there's a long kind of spread out mechanism, and unfortunately people don't get better and they don't work during that time. So that is another additional big drag on the healthcare system. Chronic pain affects everybody in all stages of life. Like cardiovascular disease usually is people that are over 40, over 50 that are big issues. Chronic pain you can have at any point in time. For example, you could have migraines as a teenager. You can have neck pain, back pain at any age, really. You can have injuries, traumatic injuries at any age. So that's why chronic pain is such an important, I think, topic. And that's why in my practice, we really try to have a novel way of addressing it. So let's talk some pain basics. How does pain arise? Well, we know we have these nerves that connect our periphery. Let's say in this case, you hit your hand with a hammer. These nerves will connect that signal. So that is basically termed nociception, the ability to kind of perceive your environment on a chemical level, and that chemistry is what sends that signal up the nerve to our central nervous system. And there are different pathways or gates along the way. There are ways that we can actually decrease the signaling of pain, and our body has these mechanisms in place to kind of regulate itself. So it has these internal regulations, and I'm going to be referring to those throughout the presentation because pain does play a role in helping us. It is helping us avoid something that is harmful. Now, in chronic pain, that sometimes, unfortunately, can get derailed, and you have a process that's happening that no longer is helpful, or that initial injury is no longer there. For example, if somebody gets in a car accident, they're no longer being traumatized in the car, but the memory of that is still kept in their bodies, and that transmission is still happening from the actual physical trauma. So there is definitely need to be able to regulate this pain pathway. So what are the nerve sensing? Chemistry. And inflammation is the signal that chemistry happens. So chemistry is happening at the cellular level. Inflammation is that signal. We've all known about that. This is not something, I know everybody that's listening has heard about inflammation before. And really, what is something that is unique to take away is that we used to think inflammation is the typical, like rheumatoid arthritis. These are kind of inflammatory conditions, or inflammatory bowel disease. When the name says inflammation in it. But now we know that almost all chronic disease is inflammatory in nature. So, for example, something like depression or even anxiety, or even insomnia is mediated by inflammation. So think of inflammation as not this big bad fire that we want to put out, which is why I really like using this Time magazine cover, because it really is a good way of thinking about it just from a very comical perspective, but it's not a very accurate physiological way. Inflammation is a signal that is necessary in the acute, but the body is not able to control it in the chronic. And that's where we get into trouble. So there's many different signaling molecules that will mediate this inflammation. But let's not just stop there, because we know that the solutions for inflammation and for pain are one of the biggest problems. We know that we have an opioid crisis. We've seen that all over the media, and definitely we're living in this post-pandemic time. That chronic pain burden doesn't go away. Yeah, doctor's appointments have stopped, and so elective surgeries have stopped, but people continue to deal with chronic pain. And medications are continuing to be used and abused. And even, we're not going to go into the detail about all the nuances about opioids and some of the negative effects of overprescription and overuse and the dependence that occurs with them. But needless to say is that they are blockers of pain. They are blockers of that nociception. They are not addressing anything to do with the root cause, why the pain is occurring. Now, if we take it a step deeper, we just mentioned inflammation is that root cause. So what if we took anti-inflammatory medications, the typical kind of NSAID class of medications? Well, what we realize is that they also block the pain, and some people, not everybody, but some conditions and some people notice that they do get better, but they also come with a lot of side effects. There's a lot of things that people do get negative impact. So for example, increased blood pressure, that's something that I've seen with my patients. Definitely stomach damage. Maybe some of you listening have experienced this. You take Advil, or you take a more stronger medication like naproxen that is prescribed typically and in more severe inflammatory conditions, and you'll right away say, oh, my digestive system is totally upset after that. Well, that's because these medications block the ability for one particular enzyme called COX-1 to basically, that controls the lining of our intestines and lining of our stomach. So ulcerations and bleeding are a big issue. And so think about people that are in chronic pain. I can think of people in my family and obviously tons of patients that are now just doing that every single day. And even though they may not have, major ulcerations, they're breaking down some of these things. So is this really still addressing the root cause? Because, inflammation, remember we said, is the signal, but why is the inflammation occurring? So I think if we're looking at pain is that kind of tip of the iceberg, then you have inflammation as a signal. And we've always said, and I've said in the past, let's address the root cause of inflammation, of pain, which is inflammation. Well, I'm actually now saying that is an intermediary stage. So maybe that's kind of the middle part of the iceberg. If we want to really get to the bottom, the start of that inflammation cascade, it's really not inflammation itself. That is a process. What is actually occurring? What causes inflammation? So I want us to have a quick conversation around that, because we really want to try to get to the root cause, if at all possible. Now, right off the bat, I'll tell you that it's not always possible to get to the root cause. Somebody that's experienced a traumatic accident may not be able to get to the root cause all the time, because that trauma's had an impact on their structure, on their anatomy, that they can't go back to. For example, if they've had nerves that have been ripped out of their spinal cord, or broken bones that haven't healed quite the same way. This happens. So there is definitely a need for some of these anti-pain medications. But can we get deeper to the root cause? So of course there's mechanical wear and tear, there's acute injuries, but then there's things that maybe that you haven't crossed your mind that may be causing inflammation. So obesity, excess sugar in the blood is inflammatory. Foods can be inflammatory. Certain fats can be more inflammatory, omega-6s versus omega-3s. We'll talk about that. Chronic stress is inflammatory. Acute stress is anti-inflammatory, but chronic stress is pro-inflammatory. This is probably the reason I started this here, is this is probably the most important, most common thing I see with my patients all the time, and we're a chronic pain clinic, is that we see people that are in constant fight or flight mode. You cannot heal, you cannot turn inflammation off, you cannot get to any of the root causes if you are constantly in a perceived state of stress. There are certain brain pathways, there are certain areas of the brain that are activated that will not let you get into that anti-inflammatory mode. There's certain infections, bacteria, viruses that can cause inflammation, chemical and toxins can cause inflammation. Just think of the last time you got a sunburn. What do you see? Redness, swelling, tissue damage. Those are all the cardinal signs of inflammation. Invisible things can cause inflammation. So these are all some of the deeper root causes. Some of them are controllable, some of them are not. Some of them we have to eradicate. Like for example, if somebody has H. pylori that's causing them pain in their abdominal area, well, you have to decrease that infectious load, and then that is going to be addressing part of the root cause. So just taking tons of ginger or tons of DGL, deglycerated licorice, for if you have H. pylori is really not, maybe improve your symptoms, but it's really not going to get rid of that actual bacteria. So you actually have to do that. We're not going to talk about all of these. This is not the point of this webinar. The point of it is to look at this from a nutrient and orthomolecular approach. But needless to say, we could probably spend hours breaking down all the influence of all these factors on inflammation. But I'm assuming everybody listening has an appreciation that these can be causing chronic pain. And so this is kind of another way of thinking about it, but this is another way of thinking about chronic pain from a more systematic perspective, from an organ system perspective. So for example, if you look at it, let's look at just from the digestive system. I talk about the gut-brain axis all the time, and it truly is something that is really ground zero for inflammation. I attend the Canadian Pain Society conference, which is a conference that's focused just for medical pain specialists. And now even at the conventional scientific research academic level, they're talking about how the digestive system is related to things like IBS and fibromyalgia. So if your immune system is dysregulated because your gut's dysregulated, you're going to get an imbalance in bacteria. And if you have an imbalance in bacteria, you can't absorb your nutrients. If you can't absorb your nutrients properly, you're going to have deficiencies in the systems that rely on those nutrients, such as the hormonal system, thyroid system, stress system. And then ultimately, if those systems are not properly regulating, not properly functioning, you are going to have an impairment in cellular energy, and cells are not going to properly function. So this is the connection of the interrelatedness. Now, this is one way that I've looked at it. Their arrows are going throughout this. It would look like a spaghetti dinner if we really truly mapped it out. But this is one way of a very common influence of all these different systems. So let's make sure that we have that as a backdrop. William Osler, who is definitely in Southern Ontario, hospital systems are named after him. And I love this quote: "It's much more important to know the sort of person that has the disease than what sort of disease has the person." This is important to understand from a chronic pain and inflammatory perspective. Everybody is individualized, and to really address chronic pain, you have to really look at that. You have to look at it from multiple perspectives. So at one of the clinics I work at, the Pain and Wellness Center, this is here in Vaughan, Ontario, I want to present to you because we're evidence-based, and that's definitely something that's in line with what we're discussing today. This is a research study that we were actually doing at our clinic with our patients that were being addressed with a multidisciplinary approach. I'm going to zoom in on some of these things for you here. But basically, all the patients are being seen by the medical doctor. They're being assessed from a manual perspective, and then they're seen by a chiropractor and a massage therapist, and then we're doing comprehensive testing. Myself and another colleague, Dr. Christine Cho, we're addressing things from a metabolic perspective, nutrition, from a sleep, and then we're looking at things from a psychology and mindfulness perspective. In our experience, only until you address all of these things are you going to have proper, comprehensive, and lasting results. So this is the backdrop of, if we're going to get at root cause of pain, this is kind of how I think hopefully everybody that's listening to this webinar is going to have an appreciation that this is how we should be addressing things. And so we've seen over 1,000 patients, and this is what some of the results that we found. So we've seen that, for example, up to almost 60% have seen improvement. This is after 4 months of being seen by all these different practitioners, typically 2 or 3 times a week, of addressing it from a mind, structural, mental, emotional, and metabolic nutritional perspective. 60% of people got better this way. Ability to manage pain, up to 75% improvement. For example, energy level went up 44%. You can see most people at least got some improvement or were very much improved. You can see these darker green lines. So the comprehensive approach to pain really, really works. This is a marker, a score of your global impression of change. So basically, after you're done the program, how much have you improved for the better? And again, 80% of patients have improved when they're finished up the program. And the great part about this is that 6 months and even 12 months after they finish the program, they are still getting, majority of them are still getting the same benefit of improvement. I mean, that's phenomenal. That means that you can have a comprehensive approach and still have an effect up to a year later. That's better than any medication that you can ever take in terms of the ability for it to continue to work even after you stop it. So anyways, the message that I have there is that you have to address all the different parts if we're going to get at the root cause. But we're going to look at this, obviously for the sake of time and for the sake of this webinar, we're going to look at the piece of the pie that's going to be addressing this from a nutrient perspective. We're not going to be able to get into sleep and to nutrition and all the things. This is a complete weekend course to go over that. But I do want to share some clinical pearls about some of the nutrients, some of the stuff you have on your shelves. If you're a practitioner, some of the things that you've used with patients. We have a lot of content here, and I'm just going to really try to focus and zoom in on some of the things that I think are most important. So we can't forget the foundations. If you think about chronic pain, remember we talked about that nociception, the ability to kind of communicate with our nerves. There are different aspects of the nervous system that need to be properly functioning. The mitochondria to produce energy, the ability to transmit. So for example, our fats, our myelin here is all about transmission. And then finally, our ability for communication between nerves. And this is our neurotransmitters. So all three of those sections need to be properly functioning. And so typically when we think of chronic pain, we think of, okay, so what's the latest extract that we can try to really get some phenomenal results? And I'm going to talk about some of those, and there are some. However, if you try to do those without addressing the foundation, you're probably not going to get some really good results. You're maybe going to get results that, after you stop taking that particular formulation, it's going to stop. So you have to look at these foundations. And again, we're not going to be able to address all of them, but there's a couple of them. The nutrient deficiencies one, I do want to focus on because it really does apply to our topic today. One of the fundamental obstacles we need to understand, and this is something for your customers or your patients or whoever's listening, this is something that's absolutely pivotal. Key takeaway number one, most people are deficient. I have conversations with people online. I have conversations with people on Instagram, my patients, where they're like, yeah, you know what? I don't really need to supplement. My diet's pretty good. And you start talking about their diet and you realize it's not very good at all. They may think it's good because it follows, let's say, the Canada's Food Guide, or they think it's what they've grown up with. They may have a salad a day and they consider that a good thing. Unfortunately, that still predisposes you to deficiency. If you have chronic stress in your life at any point in time, you've burned through some of your nutrient stores. You are insufficient. That's another thing that an important distinction is that deficiency is kind of like on an end of the spectrum here. Optimal is over here, but in the middle, there's something called insufficiency. And so you see this all the time. A good example is vitamin D, which is one of the most common nutrient vitamin deficiencies. We can see that there are levels that are like really, really low, and most people don't fall into those levels. In vitamin D, it's less than 20% of people here in Canada. But if you go up into the insufficient, now you're getting into over 50% of people are insufficient. And that means that they're walking around with less than optimal levels of vitamin D. So it's kind of like bare minimum. Some of the other important deficiencies are magnesium, potassium, vitamin D, as I mentioned, and omega-3. So I'm going to talk about all of these, but there's many more. This is a great slide that highlights some of the inadequate intakes. And this speaks to the point of people thinking that, oh, I get everything through my diet, or I take a 1-a-day multivitamin. You simply are not going to get enough nutrients in a 1-a-day multi to get anywhere near to levels that you're going to replete, meaning like improve the levels in your body. To get everything into a 1-a-day, you have to decrease the doses and you have to jam things in so hard that the absorption of these nutrients are not going to be anywhere close to being optimal. So it's almost like you shouldn't take it at all. And that's why AOR actually never has a 1-a-day multivitamin. I think the least we have is Multi-Basics 3, which is 3 a day. And then you have the Ortho Core, which is up to 6 a day. Now, a lot of people are like, well, I can't take 6 a day. Well, then maybe take half of that, but you're still getting good nutrients. You're still getting good absorption. Taking a 1-a-day multivitamin is useless, in my opinion. One of the big reasons is that you're not going to get levels that are going to be repleting things. Like look at magnesium, look at vitamin E. 56% of people are not getting the bare minimum intake of magnesium. 93% of people are not getting the bare minimum intake of vitamin E. So let's look at some of these nutrients. Magnesium, one of my favorites. I've written the True Series for AOR. And by the way, if you haven't checked out AOR's True Series, this is a great shameless plug time that I'm going to do. There's some phenomenal True Series that have come out. One of them specifically is very related to chronic pain, as it's talking about the endocannabinoid system and PEA, which I'll talk about a little bit more later in this webinar. Phenomenal resource. It's not about products per se, it's about a topic that is very relevant. We've done on magnesium, we've done one on curcumin, which we're going to talk about. We've done one on B vitamins. We've done about non-medicinal ingredients, things that are in your supplements, all the things that are not on the actual medicinal label. Why are they in there? Great True Series. So check those out. They're available on aor.ca. Magnesium, most people are deficient. There's a lot of medications that are depleting magnesium. We also don't have enough in our diet. Magnesium is so important for chronic pain. Why? Low levels are related to inflammation, meaning inflammation just is going to increase if you have low levels. So we don't know if that is a chicken or an egg situation, but we do know that if you have adequate magnesium levels, you are going to have better blood flow, you're going to have better blood sugar management, and you're going to have lower levels of inflammation. Because magnesium, one of its key roles is that it helps the ability for the endothelium, the lining of the blood vessels, to function. So one of the first key things that it should be on everybody's daily supplement list is magnesium. Here's the mechanism as it relates to chronic pain. One of the ways that it works, over and above what I just talked about inflammation, is that specifically on the actual the conduction of pain, is that magnesium offsets calcium. And calcium and magnesium, they play a role in something called the NMDA receptor. This receptor is key at signaling pain. And so when you have low levels of magnesium, calcium is able to just dominate and you have hyperexcitability of these pain pathways. That's how magnesium is related to chronic pain. I'm going to talk about magnesium malate specifically. We've all heard of magnesium malate specifically for fibromyalgia, which is definitely appropriate for this particular topic. But here's a great little chart. The Magnesium True series talks about this in a lot more detail. It talks a little bit about all the different benefits of all the forms of magnesium. So definitely the takeaway point is that you should avoid oxide in general. Citrate, glycinate, malate, aspartate, orotate, all of these have unique benefits. So one, magnesium, you could stick with magnesium glycinate or citrate for everything and you'd probably be covered, but you could actually be a lot more strategic and a lot more therapeutic if you take the right form. So one of AOR's bestsellers is magnesium malate because it's been specifically studied with fibromyalgia. One of my favorites and one that flies way under the radar is magnesium orotate. This is AOR's CardioMag. It is specific for the ability for the cardiovascular system to function and for the correction and the repair of DNA. So whenever there's damage inside cells, like for example, after a heart attack, but it doesn't have to always be after like a really severe thing, because people look at it and say, well, I don't have a heart attack. Well, it could be someone that's an athlete that wants to improve their muscle damage, even their cardiac damage. Magnesium orotate has a lot of research behind it. Hundreds and hundreds of people have been put in research trials looking at magnesium orotate. So check that one out as a form of magnesium that really flies under the radar. One point that I wanted to make about food is that there's an alkaline versus acidic quality of food. And there's research showing that if you eat an alkaline-based foods, then you have a decreased risk at certain health conditions. And definitely from my clinical practice perspective, people that are eating more plant-based, as many different colors, your goal is 8 different colors of fruits and vegetables a day, they definitely have better results. They have better ability to deal with pain. They're going to now start putting those phytonutrients back into their diet, and they're going to ultimately have a net alkaline effect. And this alkaline acidic thing is something of controversy, because people say, online you can say alkaline diet is nonsense because you can't change the blood pH. That's true, you can't change blood pH, but you can definitely change the pH of your tissue. You can definitely change the pH of your cell. So the area outside your cells and the area inside your cells definitely is more sensitive to pH. There are also quality of food. So certain foods, for example, you can see here, here's a chart that I use with some of my patients. Some of the foods that you look at, the most acidic foods, they're not all unhealthy. For example, blueberries are very healthy, but they have a more acidic quality to them. They grow in very highly acidic soil. For example, they grow under, fir trees in the wild anyways, in kind of coniferous forests. They will take up some of those properties. But typically this is the processed North American junk food diet. When you look over here, these are all typical plants. A lot of the grains, the cheeses, the really rich foods, proteins, they're not in this category. You will never eat 100% from alkaline, and some people do eat all from acidic. The goal is to be more balanced. So the takeaway that I always say is you need to be balanced. But what I want to point out is that, look, over here, vegetables are rich in alkaline minerals. So if you take a step back and we're looking at foundations, and we just talked about magnesium as being one of the most deficient things. One of the other ways that has an influence is that it can actually influence the acid-base balance in your body. So one of the main alkalizers in the body is sodium bicarbonate. You can see this here in the non-medicinal ingredients. This is something found in water, especially the most healing waters in the world, the ones that are considered most healthy. Evian and Fiji typically are considered top of the line because they have a more alkaline pH. This is important because they contain these minerals: magnesium, calcium, potassium, and even sodium, and also the bicarbonate ion. This magnesium synergy formulation, I think, is a phenomenal foundational chronic pain inflammatory formulation because if you can see, first of all, it contains your two best forms of magnesium to address chronic pain: glycinate and malate, all your trace minerals, and if you notice, they're all in amino acid forms: potassium aspartate, zinc malate. Why is that important? Because you're able to get optimal absorption with amino acid forms. And this is the same thing with oxide, you're not going to get as good as absorption because there is a mechanism in the small intestine that actively absorbs amino acids, where something like citrate or oxide is passively absorbed. So you're missing out on that active absorption. Plus, if I'm going to go on my little rant about amino acids, you're also going to get the benefit of the other amino acid itself. So for example, zinc, you're still going to get the benefit of malate. The same reason why you're going to get the benefit of magnesium plus the malic acid or malate, that's part of that compound specifically. So you're going to get kind of a double whammy, where something like oxide, you might get magnesium, you might get a whole bunch of it, but you're not going to get the other therapeutic component of it. So that's why amino acid forms are advantageous. And then you can see the bicarb, the alkalizing. So magnesium synergy, phenomenal foundational formulation, a lot of applications. Right now, it's very hot out, a lot of people getting active, really, really good electrolyte formulation, and really helpful for repleting deficiencies that often happen related to chronic pain. A lot of people will notice that they'll have an improvement when they're taking it in the morning. And if they're mixing it with lemon water, it's a great way. It's all all natural sweeteners, no sugar in it. But mixing it with half lemon kind of adds a bit of that tartness, which I think is a really nice combination. Vitamin D. We've all heard about vitamin D. I'm just going to not talk about it very much, other than the fact that lots of research showing that if you have low levels, chronic pain goes up. Often non-specific chronic pain, like people getting like, oh, I'm like my whole muscles, all my muscles are hurting, all my back is hurting, my shoulders are hurting. The way it works is that if vitamin D levels go down, calcium goes down your bloodstream, and the body starts making sure, hey, we got to keep calcium up because it's important for us for heart function and for nerve function. So we're going to increase parathyroid hormone, and that's going to now start messing around with our putting collagen and certain and bone formation in areas that shouldn't be actually put. So you're going to have phosphate deposition, you're going to have this matrix deposition on bone, on the ends of bone and cartilage, and you're going to have increases of chronic pain. So that's why, one of the reasons vitamin D is so important when it comes to chronic pain. It also is important at regulating inflammation and regulating immune cells. Vitamin D is not a vitamin, actually, it's a neurohormone. It does so many different things. So obviously, vitamin D's levels need to be tested and need to be optimized. Omega-3s. So over the years, in terms of our ancestors and our evolution as human race, our ratios of good fats to not so great fats have changed. So not saying omega-6s are totally bad fats, but the ratios have changed, and omega-6s do have a bit more of a pro-inflammatory mechanism. Comparing that to omega-3s, we're not eating as much of them, whether it's from plants or whether it's from animals. So you're going to have a little bit more of a more pro-inflammatory cellular membrane. And it's important to understand that omega-3s are about not just blocking inflammation, which they do. You can see here, if you do give omega-3s, it will block your pro-inflammatory cascade, but it's also about resolving inflammation. So this is clinical takeaway number 2. You have to think about inflammation not as blocking inflammation only. That's helpful short term, but you have to think about resolving or being part of the resolution phase of inflammation. That is the phase that gets overlooked because we think about inflammation bad, we have to block it. No, inflammation is bad, we need to resolve it, we need to remove it. That's why omega-3s are so helpful. This is a phenomenal diagram. Forget about all the stuff in the middle here. Just focus on omega-3s. They are now going to be part of the solution in terms of quenching inflammation, not just trying to block it. And you can see here, COX-1 and COX-2 over here, this is where Advil, ibuprofen work right here. Okay. And even some herbs like Boswellia, they're working right here. We need to now resolve it. And that's why omega-3s are so helpful. So quick little update for you. 2 omega-3s, you probably haven't thought about AOR for omegas, which, we are not, that is not what we're well known for, but we have 2 really unique omega-3 offerings. Number one is we have something called green-lipped FFAs, or fatty acids, free fatty acids. And I think it used to be called green lip mussel extract or something like that. This is a formulation that has been specifically studied, and the omega-3s do come from New Zealand-based green-lipped mussels. So it's a very unique source of omega-3s, but they basically give an omega-3 in a more activated version. So there's a more, after EPA gets converted to ETA, and there's another thing called SDA, and there's more activated anti-inflammatory cytokines and compounds. Green lip fatty acids already have those active cytokines present. There's lots of research, especially in dogs specifically, so it's very well known in the veterinary world about green lip fatty acids, but also with osteoarthritis in humans. So really good research on inflammation specifically. So if you're looking for a joint specific omega-3, green lip FFA is really the best option for you. Also benefits, practically tiny little capsule. Take 2 twice a day, not these massive honking fish oil capsules. Some people really find that difficult to swallow. These are very, very easy to swallow. Usually you say after 2 months, you could really notice a difference. That's long enough to trial it. And then there's a new formulation called vegan omega-3s. So this was brought out on the vegan soft gel line, then relaunched. This is all from algae. So schistotrinium oil, I probably botched that, but that is algae, so it's totally plant-based, giving you active EPA and active DHA. A little bit higher in the DHA than EPA, but still getting 0.5 gram of total EPA per 2 soft gels. Because the concentration is less than fish oil, you're obviously going to get a little bit of a lower dose, but that's the trade-off you get with a vegan source. So that's just something to consider. And it gives you an option for people that are looking for an algae-based omega-3. Okay, so now there's 3 main areas. This is a really, really important diagram. So there's 3 main areas: neuropathic type of pain, nociceptive type of pain, and hypersensitivity type of pain. And so for the rest of this webinar, we're going to basically break down these 3 areas and what are the most relevant orthomolecular nutrients and botanicals that apply to each one of these areas. And you can see there's a list of each one. So let's start. And there's specific nutrients that are more applicable to each one, and we're going to get into some of them as we go. So let's talk about nociceptive. Probably the one that most people think of when it comes to pain. Most people that are walking into a doctor's office are typically usually having some sort of joint pain, or maybe even walking to a health food store. When they have some sort of tendonitis, bursitis. So let's start with that. So I'm specifically including the nutrients and the herbs that I think are most relevant for it. And I'm not doing a full breakdown of each one, but I did want to bring out curcumin, because curcumin does work fairly well for nociceptive type of pain. So curcumin ultra has been AOR's kind of flagship curcumin. It represents the latest generation in research on curcumin. I'm going to show that to you in a second. Here it is. So what's unique about curcumin ultra is that it uses a specific form of curcumin called curcufen, and it's combined with fenugreek. So you can see here, this is the fenugreek fiber. And the unique thing about fenugreek fiber is that it loves water and it loves fat. So it can actually stick to both. Curcumin, which is this guy right in here, this is actually curcuminoid. So it's a combination of the family of curcumins. And it loves fat only. But the way that this actual extract is created is that it is combined with fenugreek, so it's going to be able to be absorbable in water, the outside of, but the inside is actually fat soluble as well. So that's how you're going to be able to get a very fast absorption, because this dissolves in the intestines, but you're also going to get a long absorption as well. As the outside absolves, you're going to have immediate release, as well as the long-term effect. Because fenugreek, if you've ever seen it before, it's kind of like sticky. It has like, it's almost like a fenugreek matrix. So it sticks to the lining of the intestines and it delivers curcumin. So that's one of the unique ways that it delivers it. And you know, some of you might be thinking, well, how does this compare to your best-selling Longvita curcumin, which is curcumin active or curcuviva? That has a totally different mechanism of action and a total legitimate mechanism of action. You can see here, this is Longvita, and they're absorbed through something called the lymphatic system and almost like medium chain triglycerides, so like fats, because it's combined with phosphatidylcholine, it bypasses the liver and gets right in the bloodstream, delivering free form curcumin, where curcumin does the same thing. The end result is the same thing. Ultimately, it's going to give you the same result because it now bypasses the liver because it's combined with a fiber. The liver looks at fiber saying, hey, that's normal, let that through. It's not going to start metabolizing it because the curcumin is hidden inside of the fiber and then is slowly released throughout the whole body. So a really unique mechanism of action, two separate ones, but they both have that enhanced delivery of free form curcumin. The added bonus about curcumin ultra is that there's an added termicin, which is a water soluble component of turmeric. So if you're going to mix turmeric in any sort of food, you're probably not getting the benefit of of curcumin. You're going to get the benefit of turmeric, and there's other polysaccharides in it. So I think curcumin ultra represents the best of both worlds. What you're going to get from a food-based perspective, and then you're also going to get a really cutting-edge extract that delivers it smartly with a fenugreek fiber. So you're getting the full spectrum of nutrients that are found in curcumin. So I think curcumin is really helpful for nociceptive type of pain, and I think ultra would be a great place to start. Boswellia, we all heard about Boswellia, very common botanical, especially used for osteoarthritis, any types of arthritis. This is specifically in joint pain, so I'll give you a little sampling of the research. Again, comparing it to another standard anti-inflammatory medication. This is actually a targeted medication. And what the unique mechanism of action of Boswellia compared to curcumin is that it works on this pathway called the 5-lipoxygenase pathway. I'm going to show you a couple diagrams in just a second. And these things called matrix metalloproteases. What they do is that they degrade cartilage. What you want to do is you want to stop them from degrading cartilage. Boswellia and curcumin both decrease these matrix metalloproteases. Unfortunately, Advil increases the matrix metalloproteases. That's a problem. So while it decreases pain, it long-term further breaks down cartilage. So that is how Boswellia and curcumin are unique. Secondly, Boswellia also has impact on other areas in the body. For example, inflammatory bowel conditions, asthma. A lot of asthma is related to the LOX pathway, the LOX pathway. So Boswellia, lots of beneficial effects you can see here. This is what makes it unique to curcumin. So that's why I actually prefer to do both together, because some people respond better to the LOX, some people respond to the COX. If you block one of the pathways, the inflammatory molecules still keep coming down the pathway and they will just continue to dump down into the other one. So you can't just block COX, you have to block the LOX pathway too. AOR has a wild-crafted Boswellia, high potency, 333 milligrams. It's in a liquid-filled capsule. So Boswellia is a fat-soluble herb. It's best combined with a fat. So it is mixed with an oil-based. So you're going to get an enhanced absorption. And you're going to get evidence-based dose. So at 3 a day, and you're going to get a full month supply. So a really, really good anti-inflammatory, could be easily combined with the curcumin ultra. Pain relief. I'm going to talk about some of the ingredients in this. You can see here they are. This is a new formulation, relatively new. Boswellia is there. at a bit of a lower dose than the standalone Boswellia. Quercetin, we've all heard of, a good potent anti-inflammatory. We've talked about magnesium. We're going to talk about PEA separately, so I'm going to skip over that one. I've talked about PEA in other webinars, so I encourage you to check out some of the older ones that we have. I've done just an exclusive PEA webinar, I believe it was last September when AOR launched it. Really, really exciting formulation, an exciting ingredient. I'm going to talk a little bit more about Univestin because that's one that we have maybe not heard of before. AOR did have this as a standalone in a formula called Arthrides, but now it's been rolled into this pain relief. So you can see here, this is called Peak Pain Relief. It also is in the Pro series called Pro Pain Relief. Univestin. One of the classes of molecules that have anti-inflammatory effects are called flavonoids. Univestin is a combination of flavonoids from two plants. They're actually not the most well known, but they're very well known in Asian medicine circles. So one of them is called Scutellaria bicalensis, which is Chinese skullcap. You can see this guy up top. And then you can say Acacia catsu, which is another word for acacia or a heartwood extract of black catsu, and that's this guy right here. Acacia tree is typically found in Africa as well as in Asia. And so there's a long history of therapeutic effect of these guys, but the combination of these two have been studied in 15 human clinical trials, showing that this combination reduces joint pain, joint stiffness, improves mobility, and especially osteoarthritis. So it's been very focused on osteoarthritis. So I would say the Peak Pain Relief is an excellent osteoarthritis formulation. But in general, it will be applicable to a lot of different chronic pain. And I'm going to break down at the end what particular conditions would be most relevant to what particular formulation. Really excellent safety profile. Another reason why Univestin is such a great formulation, because typically bioflavonoids are very, very safe. You can see some of the beneficial effects. It addresses, that's claim to fame, it addresses both LOX 1, 2, and 5 5 LOX. So you're going to get both COX and LOX inhibition, which is great because you're not going to get a spillover effect. You're going to have an anti-inflammatory effect on both. And I think that's what makes Univestin really unique. You can see just in as little as 7 days, Univestin's starting to see beneficial effects. And active controls, again, they're using other medications that have been studied for joint pain. One of Univestin's claim to fame is that one research study is actually showing that Univestin had similar decreases in pain as something like naproxen. And naproxen is a well-known anti-inflammatory with a whole host of negative side effects. You can see, again, this is a little bit more of a longer time. You're going to see Univestin. You're going to see high dose of Univestin, 500 milligrams. Here you go. You can see you're going to get right up into those. That light blue, you're going to get into the most beneficial effects. So really, Univestin showing improvement in joint stiffness, mobility, and joint discomfort. And I mentioned claim to fame is that it blocks both of these pathways that end up in inflammation. So part of the nociceptive pathway, we still have to talk about the endocannabinoid system and PEA. So I'm not going to go over this in a ton of detail, other than the fact that we all know about cannabis and inflammation. One of the reasons that it does have this impact on inflammation is that it works on these anti-inflammatory receptors. One of them is something called PPAR. There's CB1, CB2. They have anti-inflammatory effects. And so cannabinoids found in cannabis, or even synthetic cannabinoids like nabilone, they are going to be addressing CB1 and CB2. But look at all these other receptors. That's where something like PEA or palmitoyl ethylene amide. This is a fatty acid found in food. It's found in breast milk. It's found in egg yolks. It's found in all sorts of different types of foods. And it's naturally found in our cellular membrane. And it's incorporated in the cellular membrane and used in cases of pain, inflammation, and damage. So the body is very smart. It actually allows levels to be built up and then used as needed for any sort of stressor. Now think about that. If you're under a lot of stress, under a lot of chronic pain, you're going to be using up your PEA stores because they have to be incorporated into that cellular membrane. So PEA is a true orthomolecule because it is found in food. The body can extract it out of food just like a vitamin, and it's used for quenching inflammation. Now that's a really cool mechanism of action, but what about the actual research behind it? Because cool mechanism of action only gets us halfway. Well, in the case of PEA specifically, there's tons and large volumes of research showing the benefits of its effect specifically on chronic pain, which is what I'm going to focus on. But overall, there's 50 human clinical trials showing that it reduces inflammation, addresses anything from things like immune system, neurological conditions, mood, and much more. So check out that PEA webinar that I did last year in 2019. The added bonus is that it's super safe. So this is a particular product that AOR was the first to Canada to launch. And you're probably going to see a lot of other companies coming out with it because of the research is so strong and the molecule is so unique. Specifically in pain, I wanted to just highlight a couple things for you. 19 human clinical trials, 5 of them are like gold standard, randomized, double-blind, placebo-controlled, and many of them are adding on to a typical anti-pain medication. And what they found is that combining them with whether it's an opioid, whether it's a nerve blocking medication or a typical anti-inflammatory, they noticed an improvement in pain as well as a decreased usage in prescription drugs. This is massively important in the whole opioid crisis. This is one particular study. You can see the red line here is the combination of tabantol, which is an opioid, combining that with PEA. Now, if you're taking an opioid, you have pretty hardcore pain. And that's probably something that has to be really addressed surgically or through a really comprehensive program. But typically people that are on opioids, they're very difficult to get off. But they're on it hopefully for a really good reason. But we would try to reduce the amount of opioids they're on. That's where PEA comes in. It can be very helpful at reducing the amount of medication that it can be on. So talk to your doctor about that. This is a snapshot of some of the research study. Here's one of my favorites, especially PEA is really effective for sciatic and low back pain. Really good AORs at multiple different doses. You can see here's some anti-inflammatory effects. Here's peak pain relief, multiple doses. It's 400 milligrams per capsule or it's 600 milligrams per lozenge. They're both in the retail line, peak pain relief. There's also a specific formula in the Pro Series that does have a capsule that is in a micronized form. Or yes, in a micronized form. Most people notice benefit within a month. That's something important to point out. Like sometimes you take curcumin or even Boswellia, you'll notice an improvement right away, maybe in a week or so. PEA does take a little bit more time to kick in because it's a fatty acid. It's kind of like, when's the last time somebody has taken an omega-3 and they're like, oh, my joint pain's better in a week. I've never seen that. And if somebody does have that, please let me know what type of omega-3 that is, because I just don't think that's the mechanism of action. You need to build up levels into your cytoplasm. And then ultimately after that, that's where you can have, over time, I have less pain, I have less inflammation. The same thing with PEA. It takes time to be built up. But it can also be combined with other of the more faster acting anti-pain botanicals. So for example, curcumin, Boswellia, combined with magnesium and many other nutrients. It can also be combined with medications. No interactions because it works on the endocannabinoid system and it is an orthomolecule, truly something that's found in diet. So that is nociceptive pain. So I just talked a little bit about that. So those are the top 3 things to think about. So think about the peak pain relief, think about Boswellia, think about curcumin ultra, and you think about PEA by itself. Those would be kind of top in the nociceptive category. I will make a caveat, as I said before, you can see PEA is in every single one of these categories here. So as we move into the hypersensitive section, PEA is applicable to that as well. But there are subtleties of difference between what you suggest in nociceptive versus what you'll find in hypersensitive. So I, for example, don't find curcumin Boswellia helpful in things like fibromyalgia or things like headaches. I mean, they're worth a try, but you're probably better off going with something like PEA or something like B12 or magnesium that are going to be working on a bit of a different mechanism of action. So I'm going to share that with you. We're going to start a little bit about headaches because I think headaches often get overlooked. We often think about things like joint pain and inflammation and cancer a little bit more when it comes to just general inflammation. But headaches are a massive issue, and it's definitely a very common thing that my patients come to see us at the clinic. You can see here, many people suffer from migraines. 1 in 16 men and 1 in 5 women. Unfortunately, it really affects females more than males. Even children suffer from migraines. It's lots of different symptoms, aura, pulsing over eye, and typically as soon as it comes on, a person has to really shut down and really try to abort that migraine. There's a lot of different causes we don't fully know, and again, this is not going into a lot of different detail, but there is potentially a hormonal component. There definitely could be a nerve compression component. There could be definitely a muscular component where there's a nerve being entrapped. And it could also be entrapping the blood vessel. So definitely blood flow is a massive component to migraines as well. So we typically switch from the traditional anti-inflammatories like curcumin and Boswellia, and we start looking at what are things that are going to help blood flow, and we're going to help mitochondrial function. And if you look at migraine in the context of other headaches, there are other headaches, cluster, allergic, or other ones that kind of have specific impacts on the brain. In the allergic category, it may be a food that you're eating. I see this all the time as, people that are like, oh, I'm getting constant headaches. And then they identify food sensitivity, they avoid that food. And then, after a couple of weeks, the headaches have gone away and they haven't really changed any medications or any exercise or anything other than their food. Tension and cervicogenic headaches, maybe you've heard of those. Those are typically more muscular and more positional from a neck perspective. And they do respond much better to curcumin and Boswellia than the top 3 do. So that's just something to take away. So just this month, AOR launched a formulation called Migraine Manager. So I think it's really appropriate that we just briefly talk about it. Migraine Manager is a formulation that is addressing all the root causes related to migraine that we just talked about, and it really takes a look at some of the more commonly known botanicals like feverfew, magnesium, for example, riboflavin B5, but we've done it in a really evidence-based way. We've put dosing that is really reflective of what's in the research, and we've added things like vinpocetine, magnesium, and rosemary that also have blood flow beneficial effects. So we're going to be addressing blood flow, and you can apply this, anybody that has any sort of neuroinflammation. This could be applicable if somebody they've had a brain injury in the past, or addressing the impact of headaches due to potentially recovery from a stroke. So there's major applications, but definitely migraines is the main one. We've talked about magnesium. We're not going to talk about that. Lots of research about magnesium and the blood flow and migraine specifically. Riboflavin, we've all heard about it. Even I've had neurologists, say, oh, go find B2 at the health food store and then, take that and then you'll be good. At least you'll be covered nutritionally. So there is some awareness now that's occurring as it pertains to B2 specifically. One of the big mechanisms that B2 has in its impact on migraines is that it improves mitochondrial function. Remember that diagram I started right at the beginning showing the nerve and how the mitochondria, and if the mitochondria aren't properly functioning, the nerve can't properly function? That's the connection with B2 specifically and pain, and specifically headaches. B2 optimizes mitochondrial function. It's been mainly studied prevention. That's why I highlighted that. Migraine Manager is probably more of a preventative formulation. And to be perfectly honest, it can be tried if a person gets a migraine. But honestly, if a migraine is coming on, there's very few things, medications included, that actually do make a big difference. Usually people have to go into their kind of dark room, into their headphones, kind of close their eyes to get get themselves out of that headache and out of that major migraine. So a really good dose, 400 milligrams per day for migraine prevention. It also has some other beneficial effects. It lowers homocysteine, and you can see there's a couple other mitochondrial supportive ingredients, like for example, the advanced B complex, AOR super focus would be an excellent one that I think would be a very synergistic combination. You can see here's the neurotoxic cycle. I'm going to just skip over this. This is more for the research geeks. that are listening that's going to look at all the different beneficial aspects of riboflavin. So you can see there's 5 of them. We've talked about some of them, the mitochondrial function, but it also has anti-inflammatory effects and anti-cytotoxic and excitotoxic effects. Vicositine, so periwinkle extract, traditionally used for blood flow issues. So it's similar to ginkgo, except with less side effects. And, I need to take a lot lower dosage of it to get a therapeutic effect. It's a potent anti-inflammatory. You can see that here. Decreases inflammation, decreases vasoconstriction, and decreases just general cell toxicity. It improves blood flow to the brain. It has a little bit more of a broader effect than ginkgo, and I recently did a really deep dive into ginkgo. I presented a lot about ginkgo in the nootropic webinar, so check that out. I did that back in May. You can see that on aor.ca/webinars. And ginkgo does have some mixed benefits. Vimpo has this added benefit of supporting eyes. I mean, I think anything that supports brain function are also going to support eye function as well, because it is an extension of the central nervous system through the ocular nerve. So it does have this impact on eyes. Rosmarinus is rosemary, traditionally used as an essential oil or tea for migraine relief. Some people actually will apply the essential oil for focus. They'll apply it to the different areas of their head. Potent anti-inflammatory, also helps support good bacteria in the gut. It's anti-allergy as well. And then finally, feverfew. Feverfew has lots and lots of research showing on it, specifically, again, from a preventative perspective. You can see here, decreasing the migraine frequency by almost 2 attacks a month. That may seem really small to people, but anybody that is a migraineur or a person that suffers from migraines, they're going to know decreasing their migraines by 2 per month is like amazing. So the consistent supplementation of feverfew does have a beneficial effect. And this was found in a Cochrane review, which is a really comprehensive review of all the research out there. So really improved the decrease in frequency, but once symptoms are starting or the migraines that they'd have, they didn't really change. So summary, Migraine Manager, most comprehensive kind of migraine formulation on the market, addresses multiple mechanisms of action, the stickiness of blood, inflammation, blocks pain, supports the energy production inside the cell, and supports blood flow. 2 days is the typical maintenance dose, but you can go up to 4 day if you need it. Again, typically with any headaches, it'd be best to be more aggressive. And then maybe combine it with a little bit more magnesium. You can definitely try something like curcumin, especially if it's cervicogenic, if a person doesn't know if it's coming out of a muscle. And that combination, super focus would be another great combination in terms of supporting mitochondrial function and obviously our advanced B complex or any of the foundational products. Magnesium malate, we talked about that. We're going to skip over that for the sake of time, just to make sure that we're on track. Yeah. And then we're going to go right to neuropathic. So just a quick note about curcumins. So we have 3 different curcumins here. So when do you use any of them? Well, technically you can use any one of them. So you can see curcumin ultra, that's kind of like the high extract, high potency, looking for a high amount of curcumin. You could probably put in curcumin active in that category. There's a formulation called Advanced Pain Relief. It used to be called Themis. This was designed as a muscle relaxing formula. So anybody that is looking for, menstrual cramps, I usually recommend Advanced Pain Relief. It has things like ginger in it, has California poppy, which has an analgesic effect, magnesium. It's going to have curcumin as well. It has the long vita version of curcumin. Then there's inflammation relief, which is the combination of Boswellia and curcumin, a little bit of ashwagandha, and then we talked about our Migraine Manager. So any 3 of these is a good combination with Migraine Manager. Now that I broke it down, you can apply any of these, but I think in my experience, people get the best results in terms of quick acting if they're going to use curcumin ultra. I found the other ones, these other 2, you got to dose really high, like both of them 2 twice a day, and you're going to blow through that pretty fast. So that's a 2-week supply, they're great formulations, but you just have to be aggressive with the dosing early on. Where something like curcumin ultra or curcumin active, you're going to get therapeutic benefit with just taking 1 or 2 a day, because the dosage and the potency is really good. Okay, so last category is neuropathic, and then we'll have some questions. So again, You can probably apply the PEA here. Lots of research on PEA and neuropathic pain, also specific with diabetics. And we're going to talk about some of the specific things as it relates to neuropathic. Neuropathic pain is something that we typically think of, oh, that's just for the diabetics that have nerve damage, or somebody that has post-chemotherapy that have numbness and tingling. Neuropathic pain is a massive concern. You could apply neuropathic pain to almost every major pain syndrome or condition. Headaches, for example, can be considered neuropathic pain. Neck pain, back pain, sciatica, pinching of nerves, any sort of pinching of nerves that are going to decrease in the conduction of nerve function can be termed neuropathic. People could have neuropathic after a compression, for example, something like carpal tunnel. You can have neuropathic pain in thyroid conditions. That's a big one that flies under the radar is celiac, that's undiagnosed, and thyroid conditions like hypothyroidism or hyperthyroidism, as that can cause compression of certain nerves. So don't think neuropathic pain is just, just for the burning and tingling. Yeah, that's the main one, but there's many other ones. You can see here, the mitochondria are ground zero for neuropathic pain. If you have too much inflammation for all these factors, compression, damage, I talked about hypothyroidism, lack of oxygen, you're going to have more inflammation, mitochondria is not going to work, and ultimately the nerve's going to start to die. And so that is what gives you that numbness and tingling. Why are nerves so problematic? They don't have really good blood flow. They're outside the blood-brain barrier. They're very susceptible. They can be very small, and there's a very limited lymph drainage. And I bring this up because I think it's important to understand the resolution part of the inflammatory cascade is really driven by the lymphatic system. And so movement, physical hands-on manual therapy is important because it helps move lymph. So that is something that's important to consider, and that's why nerves don't really have a lot of lymph movement, and they have lots of oxygen, and they have lots of blood flow demand. So it's kind of this unfortunate combination. Lipoic acid, one of the most well-known antioxidants that is related to nerve pain. A lot of the research in the 1990s was done on intravenous lipoic acid. They were looking at it for diabetic neuropathy, and they started demonstrating positive effects. And now oral lipoic acid has been further studied, showing that it does improve sugar metabolism, improved insulin resistance, and it decreases symptoms of diabetic neuropathy. It may also decrease symptoms of carpal tunnel as well. There are many mechanisms of actions. Lipoic acid is, similar to curcumin, a bit of a jack of all trades. A couple of unique takeaways about lipoic acid. Number one is it's both water soluble and fat soluble. That's really unique. Number two is that it helps recharge all your other antioxidants. So it helps make them more effective. That's really helpful. So that's why we consider it kind of a network antioxidant. And it also is a potent detoxifier. So if a person does have issues with toxicity, it can help support that, supports glutathione function. It was first originally discovered and used as a therapy for mushroom poisoning. And majority of lipoic acid is sucked up by the liver as soon as you take it. So from a practical perspective, you're going to get maybe about 30% of it absorbed into your bloodstream. Majority of the rest of it is all taken by the liver because it needs lipoic acid that much to combat its free radical damage, to support glutathione, improve nitric oxide. So these are some of the beneficial effects. You can see it here, and it does have this ability to protect the liver and lower inflammation. It also has the ability to support mitochondria. So that's one of the key things of neuropathy is you're going to see things like acetyl-L-carnitine, you're going to see things like lipoic acid. These are major kind of mitochondrial antioxidants. The mitochondria are really, really rich in nerve tissue. So that's why mitochondrial support goes hand in hand with nerve support. I mentioned the endocannabinoid system, and PEA is really, again, top of the list. I didn't include in the section because we already talked about it in the nociceptive section, but there's a formula that was launched recently called Peak Antioxidant Support, which is a combination of lipoic acid and PEA. I actually really like this dose. This is a phenomenal dose. because it allows you to dose properly. What I mean by that is that both PEA and lipoic acid should be dosed regularly, especially lipoic acid. It should be dosed throughout the day because it's absorbed pretty much, in about 20 minutes to half an hour. And then it kind of is in the bloodstream for a couple hours and then it goes away. So it's a very, very rapidly excreted. But if you dose it like one capsule, ideally 4 times a day, then you're going to get the optimal coverage throughout the day and you're going to have that therapeutic effect. I think one of the reasons people don't get good effects is that they don't take supplements properly at the right time. And they may not be taking enough of it. And this is one of the cases of you probably need to have enough, but you also need to be taking it at the right time. And I think with lipoic acid has to be frequent dosing. So I mentioned PEA. You can see really, really great applications. Just reminding everybody, PEA is also applicable to neuropathic pain. So in summary, there's lots of different pain conditions that we touched on. Again, you can tell I skimmed a lot of it. We could have dove down into a lot more detail, but this is going to give you a couple little pieces of where to apply each formulations. Migraine, definitely you could try curcumin magnesium advanced pain relief. Does have California poppy in it, has ginger in it, but Migraine Manager would be the first kind of option, and then you can look at potentially doing something like peak pain relief. Advanced pain relief. Peak pain relief is the quercetin univestin formulation. For tension headaches, myofascial pain, look for magnesium. Tension headaches, the combination of magnesium and curcumin, great results with that, very fast. If there's menstrual-related issues, then advanced pain relief, that's what it was formulated for. And then you could throw in a formulation that actually addresses hormones. Typically, people are getting PMS, they're getting dysmenorrhea, which is like pain right before their period and when their period is happening, because there's inflammation happening, and there usually is a hormonal imbalance, typically an imbalance of estrogen versus progesterone. So EstroAdapt is a formula that will help move some of that estrogen into the right metabolites. When it comes to osteoarthritis, any sort of the curcumins will be helpful, but inflammation relief or curcumin active or ultra would be good. And then the green lipped fatty acid, and then the univestin formula. So those would be the 2-3 that would be optimal there. Rheumatoid arthritis, definitely include Boswellia. Lots of research on autoimmune inflammation in Boswellia. Curcumin, so I would probably say a high dose of inflammation relief along with the peak pain relief for the univestin would be optimal. Diabetic neuropathy, peak antioxidant, peak pain relief for getting optimal PEA, and then something like B1, carnitine, and B12 would be helpful. Sciatica, same thing, add the B12 in it. PEA is the big one on sciatica, carpal tunnel. Your B vitamins are really important there. Fibro, you're looking at magnesium malate, and you're looking at ribose, D-ribose, or ribogen. And then tendonitis, you're looking at curcumin ultra, high doses acutely. So hopefully that gives you a little bit of an overview. Take a look back at these particular charts to look at which formulations might be more applicable. Not every single pain condition is going to respond to the pain formula. Not every pain condition responds to curcumin. That's what I see all the time with other patients coming from other practitioners, and from even a lot of health food store clerks. We have to look at being a little bit more tailored, and we have to be looking at a little bit more specific on which particular nutrient, which particular formulation is going to be most relevant. Are you taking the right dose? Are you taking the right combination? And maybe then, after you have some of the foundational pieces, starting with magnesium, B vitamins, vitamin D, then you can start adding in something like, peak antioxidant for diabetic issues, or the peak pain relief for any sort of sciatica issues with try B12 synergy and the lipoic acid and the peak antioxidant. So there's a lot of great options to address chronic pain and inflammation in the AOR line. So at this point, we're going to open it up to questions. I'm going to let Nirat take over. She's going to handle the Q&A, and we're going to see if there's any questions. Go ahead, Nirat.
Yeah, thank you. That was great. So much information, and we got it done in time, which is amazing. I think a few questions that came up. One, in relation to tolerance, I think you discussed a lot of different options, and I think a lot of hesitation comes from with opioids or pharmaceuticals comes from building a tolerance. How do you address tolerance when you're taking more of a nutraceutical approach?
Yeah, it's a great question. The beauty about nutraceuticals, and this is again what the research is showing, is that tolerance is not a huge issue. So first and foremost is, I'll address this question in two ways. First, people come to see me with tolerance issues because they're on, let's say, opioids. So the first thing is that they're using their opioids as a crutch. So we have to put in the foundations they need to properly function. So for example, if somebody's using opioid medications or NSAID medications, one of our goals is to reduce the amount of medication. So always do this with a healthcare provider to help wean off, and especially the one that's providing. So never go off opioids cold turkey. But what you can do is that you can add things like PEA, which has been studied in combination with opioids, and the foundations like adequate magnesium. And those foundations will allow people to handle inflammation better. Once those foundations have been set, and I have to say that that usually occurs over a period of months, not weeks. So magnesium, for example, takes up to 6 months of regular, consistent supplementation for 6 months straight to properly replete levels. 60% of magnesium in your body is stored in your bones, and that's the first place the body is pulling it out of. So you actually need to fill that up first before it starts penetrating tissues and having that really, saturating effect. So foundations first, then you have to look at interventions like PEA that have been studied. In terms of tolerance with natural substances, that's part of their beauty, is that the trade-off is that they may not be as like instantaneously effective as pharmaceutical medications, but they often don't have this kind of addictive or tolerance issues because they're working on multiple mechanisms of action, and they're not just totally shutting one pathway down, that the body is no longer going to be producing its own endogenous molecules that are working on anti-inflammatory pathways.
Hmm. That's a great point, and I think also feeds into the next question, which was about safety, particularly in children, because if we're not building that tolerance, and if we're also addressing different mechanisms, um, this question is particularly with Boswellia and safety.
Yeah, one of the big things about Boswellia, even compared to its brother curcumin, which is always recommended together, is that there's a lot less safety precautions. So Boswellia doesn't have the same issues with in terms of coagulation medication, anticoagulants like warfarin, ulceration. Of course, people can be sensitive to any sort of herb. That's for sure happening. But Boswellia is very well tolerated. It is a fat-soluble substance, and so typically taken best with meals. And once you take things with meals, they usually are better tolerated. So overall, that is kind of my safety spiel. So I always rely on Boswellia to give me a little bit more of a safe approach if somebody is worried about some of the medication interactions. And I find it is very safe in my clinical experience.
Okay. We had a question in regards to copper toxicity, and that was mentioned, I think, in relation to the magnesium synergy. So what was the benefit of copper in pain management?
Yeah, that's a interesting question because it is definitely something that is on my radar, and it's not on a lot of other people's radars as a potential toxicity. You can be deficient or you can be excessive in any number of minerals. Typically, to really identify that, you're going to have to do a hair mineral analysis, and that blood work, it can be helpful. Ceruloplasmin is a particular lab value that does address copper levels. It typically is also related to inflammation. So I've run it in the past. There's research showing it can, looking at progression of certain chronic issues like cancer. So you can have chronic high levels of iron or copper, But you can also have depleted levels. If a person, let's say, has been taking zinc because they heard it was a great thing for their prostate, for example, for 5 years, and they haven't been taking any copper, because zinc will deplete copper. So you have to look at it from both sides. Any sort of mineral can become toxic in high levels because it start getting deposited in tissues. That's as simple as that, is that it starts being deposited in nerves. We've seen that in, case reports with, hemochromatosis, in high amounts of lead and mercury, which are specifically neurotoxic. Copper isn't neurotoxic. It has a nutritive value, but in super high levels, it can also saturate nerves. So it is something to consider, and it probably needs to be worked up if suspected.
Mm-hmm. In addition to some of the chelation therapies, then perhaps would you suggest doing some herbal detox therapies?
Yeah, well, obviously, I think the herbal is a more gentle approach. If somebody has copper toxicity or any toxicity, then I would say you definitely need to do, a very medically monitored chelation protocol. That's usually using EDTA or DMSA. But it also pulls out some of the good stuff. So the good stuff has to go back in. So that's why I insist it has to be kind of medically supervised. But if you want to start and you are not going through kind of the standard chelators, then you can definitely use things like, modified citrus pectin. You can use things like D-glucarate, which are going to start stimulating your body's own detoxification enzymes, lipoic acid, some of the dietary things, cilantro, parsley, vitamin C, garlic. These are all things that have been studied to pull out things like lead, for example. There isn't anything natural that I've seen that's really good for copper or even hemochromatosis, which is iron toxicity. Those are things that you need more medical interventions for.
And we do actually have some past webinars, so if anyone needs more information on that, just check that out. And actually, you did mention lipoic acid, and you mentioned the pulsed dosing throughout the day. What are your kind of thoughts on people who want the sustained release versus the immediate high dose? And can you speak to form, the R versus S form?
That's a really good question. I just wrote a blog on this, so it's really fresh in my mind. Lipoic acid usually comes in the alpha lipoic acid form. And alpha lipoic acid is a combination of both, two forms. And they're kind of like they're a chiral image of each other. So meaning they'll fold over on each other. You see that? This is very common in kind of biochemistry. So one of the forms is the S form, and one of them is the R form. And the R form has been identified to be more bioactive, and it is the one that has the more therapeutic effect. Alpha lipoic acid is a 50-50 mix of both S and R. And there's research showing benefits of alpha lipoic acid. And now I think the evolution has been if we can take the S form out, which is what the R lipoic acid is, which is what AOR uses, and AOR was one of the first in the world that actually identified R lipoic acid as the bioactive form. You can now get the benefits without the negative effects of the S form, because the S form we think that this is the case, but it may kind of inactivate or decrease the beneficial effects of the R form. So that's the first part of the question. The second part of the question is that because lipoic acid generally is unstable, first of all, I suggest always taking it by itself. I prefer to take it in maybe formulations with 1 or 2 ingredients. Malt of massive amounts, you are starting to get some interactions happening. That's number one, because it's unstable. Secondly, it's a very fast absorbed, and so you need to be taking it throughout the day. So I prefer, if ideally possible, to have 3 or 4 doses throughout the day, divided doses. Some people can't do that, or they prefer to kind of take a sustained release. So the difference with a sustained release is you're going to get a low level over a period of time because it's slowly being absorbed, but you're not going to get this peak where you might get a more of a therapeutic effect. So I'd rather have 4 peaks during the day than kind of a low effect. That's just my personal clinical opinion, to really get the therapeutic impact. So again, also, the other thing is that we know the research is on a certain dosage. If you now start doing a sustained release, will you get up to some of those doses? So ideally, maybe taking both, or taking a high dose sustained release, like 300 milligrams sustained release is a much better option. And I know that's something that that's the approach that AOR is taking. So you're going to have to look at both options to optimizing lipoic acid.
Excellent. Well, thank you. We had some excellent questions. I really appreciate you taking that time to go through it and the presentation in general. If people want more information from Dr. Urkel, you can find him online on Instagram. He's so much a wealth of information. It's at Dr. Paul Urkel ND. And if anyone does have additional questions that they didn't get a chance to ask today, you can email them to marketing@aor.ca, marketing@aor.ca. Our next webinar is actually with myself. It is on July 14th at 12 p.m. Eastern Standard Time. We're going to be discussing natural and effective ways to turn back the clock for healthy aging. So if you're not yet registered to that, you can always sign up at aor.ca/webinars with an S, /the letter B, the number 2, the letter B. Thank you everyone for joining us this afternoon. I hope you have a safe and healthy day, and we will see you soon.